What is up, YouTube? It's your boy Zed back at it again with another video, and today I'm going to talk about the different routes that you can take after receiving your CNA certification. Now, as you know, I've been dropping content weekly about being a CNA, my experience, my journey being a CNA. I drop videos about how to study for the CNA exam, how to practice for the CNA exam, what to do to get in the CNA exam, and also my experience while being a CNA, certified nursing assistant, or in some places they call them PCTs or even a nursing tech. So yeah, make sure you check out those videos below. And before we get into the video, subscribe to the channel. I post weekly content, all things CNA, all things nursing. Follow me on the gram at IZLERY right here, and also my Twitter at LuckyleftZ. Now let's get into the video. So this video is really directed for people that's going into being a CNA, and also some people that's they already have their CNA certifications. This is a next step after getting your CNA certification. It's multiple routes that you can take. You don't have to always stay a CNA. And in most cases, I'm seeing people are moving into different fields or different like next step practices from getting your CNA after receiving your CNA certification. Again, these varies for each state. The qualifications vary for each state, so make sure you check out the videos that I have listed below, because they would include pretty much everything you would need to be a CNA, and also kind of like learning a little bit about how the job is going to go while being a nursing tech in some cases, or even a CNA in some cases. But yeah, so I'm going to talk about three different ways that you could, three different routes that you can take after receiving your CNA certification. And that's going to be your RN, registered nurse, your PT, physical therapist, going to PT school, or even your LPN, which is offered at some places. Like, it's usually specialty schools. I know a lot of people that I know are doing theirs at like ECPI, maybe even a community college. The first one I'm going to talk about is going into being a registered nurse. In most cases, the CNAs that I run across, the CNAs that I talk to, the CNAs that I work beside, all of us are really going for our RN. Again, these are multiple routes that you can take. You can do it at a 4-year traditional school. You can take yours at an ABSN, which is the route that I'm taking, which is your accelerated nursing program. If you already have a 4-year degree in a non-nursing major, this is something that you could do. Or even if you do it at a community college program. I know most of the ADN programs are offered at community college, which is your associates in the nursing, basically. So, yeah, again, a lot of hospitals, once you get your ADN, they will want you to move on to get your BSN in like a 2-year span or 3-year span. In some cases, they'll even pay for it. The hospital I work at, they will help you get your BSN. Kind of like a bridge program, something like that. And then 2, you can go into LPN, which is like a licensing practical nurse or licensing practicing nurse. I know that when I work at my nursing homes, it's not always an RN I'm working underneath. I know they're somewhere in the building, but it's usually an LPN, which is like, I wouldn't necessarily say it's a level down from RN, but it's just nursing homes usually have LPNs. That's just how it goes. It's just what I'm seeing. And later on in the video, I'll describe exactly what they do and the qualifications to get there. And then last is going to be PT. Not many people that I know go into PT school after getting their CNAs, at least not the people that I work beside, but I know that this is an option. And you can also do these at a 4-year university, or even I think it might just be a 4-year university. I'm not sure. I could be wrong. If you feel like I'm wrong or you know anything else, comment below, but they may be offered in a kind of like accelerated format. Again, I will talk about that later on in the video. If you already have a 4-year degree, I feel like it might be a little easier for you to get into these programs. It helps. And for the most case, I think you would need a 4-year degree. I know nurses that go into PT as well. So, yeah. So we're going to start off with registered nurse. They give direct patient care to patients that they have due to their patient demographic. Basically, they are the ones that's going to monitor a patient, keep a patient alive, give life-saving kind of like treatments and stuff like that, and also administer medications. As a CNA, you cannot administer medications. Again, I see this a lot in other people's CNA videos, but if a nurse does ask you to give a patient some medicine, don't do it, because you can get in trouble, hurt the patient, or even lose your certification, and they could lose their license. So I see CNAs post that all the time. I figured I'll give that insert. So yeah, to get into a nursing program, you will have to most likely have the prereqs already done. Again, CNAs, a lot of them are young. They can go to a four-year university, but it's not necessarily required, especially from what I'm seeing now. A lot of nurses that I work behind have taken multiple routes. Some of them already have families. Some of them were already, in another career, and they just decided to change, kind of like what I did. But you can take prerequisite classes at any community college, whether that be in class or even online. These are two options that you could take. To be a RN, you would have to go to some form of program for registered nurses, which from what I'm seeing can take anywhere from about 12 months to 16 months if you're doing an accelerated nursing program, or even 4 years if you're doing a traditional program. These are some of the options that you can take, and depending on your circumstances, depending on what you feel like you want to do, this is something that you can take advantage of if you already have a degree, or even if you just have your CNA certification and you want to go into being a nurse. Those classes will include Anatomy and Physiology 1, Anatomy and Physiology 2, microbiology, chemistry, some form of statistics, and I feel like I'm missing maybe nutrition. Again, every program is different. I've seen programs that don't require chemistry. I've seen programs that require chemistry. I've seen programs that require you to be a CNA, and some of them don't. But for the most part, having a CNA certification will not hurt you in the slightest. If anything, it's going to give you a kind of like a step forward, or a heads up when it comes to nursing, because you already know how to care for patients. You already know kind of how to communicate with patients when you walk into the room, and some of the nursing etiquettes that become second nature while working as a CNA. You would definitely have a higher level of knowledge, a higher level of knowing than people that don't have their CNA certification. I feel like it can't hurt you at all in the slightest, and I will have a little more information in the description below. So let's move on to LPNs. So after doing a little more research on LPNs, from what I just did, it looks like they basically are RNs, just with some of the stuff that RNs can't do. For the most part, they're changing dressings, they're giving medications, they are able to kind of like monitor and assist the patient in any way. It looks like they're an assistant to doctors and even some RNs. Depending on from what I'm seeing, I haven't seen any LPNs in a hospital. I think that's more of like a nursing home thing. Maybe nursing homes are only required to have LPNs there. You basically have the same knowledge as a nurse, but not all of the clearances that nurses would have. I've seen LPNs give medicine. I've seen LPNs change dressings. You, as a CNA, if you work in a nursing home, sometimes you do report to LPNs if that's what you have on your floor. So I'm not sure exactly how interchangeable LPNs or RNs are, so I don't want to talk about it as much. But from what I'm seeing, they can do exactly the same things. A lot of the stuff that was listed as under a RN's job description, the job duties, is the same exact thing for LPN. But I do know that LPN doesn't have as much clearances as a RN does. So maybe that's going into a hospital. You probably would want your RN because you probably won't get hired as an LPN. You let me know if that's different in your area. I have not met one LPN at my hospital that I work at. So without further ado, we're moving on to PT. So now you have your PTs. So you're going to go into being a physical therapist after you receive your CNA certification. That would simply require some of the same stuff that an RN would. I just looked on some of the programs. You're basically needing your ANP1 as well, ANP2, chemistry, statistics, biology, microbiology, and for the most part, that's all that I've seen. Again, each program is different. I'm sure that there's some other stuff that you would need to do. Maybe they need you to take a TEAS exam or something like that. Most nursing programs do as well, but going into PT is basically a doctor of physical therapists. So again, these programs take a little bit longer than some of your RN programs would, especially if you have some of your prereqs already done, or all of your prereqs already done. PTs basically go in, they help with the patient. I've seen PTs in a nursing home, and since I work nights, I have never seen them in a hospital. Granted, I know that they go in the morning. I know that they're there in the morning. They check on patients. They assess a patient's movements. They help a patient get better. They give a plan of care when it comes to ambulating them, moving them, making sure that they are able to sustain their own body weight. And they do some like range of motion practices and stuff like that. But basically, being a PT is an option after you receive your CNA. I'll list most of the stuff that they do underneath. I didn't want to make this video too long because I know attention spans get short, but and I don't like to make my videos too long anyway. Most of the information you'll be able to find underneath. But yeah, those are the 3 routes that you could take. I kind of did like an overview on each one, whether that be RN, LPN, or PT. If you want me to make a more in-depth video on each of these, I can do that. It's not a problem at all. But I just wanted to give kind of like an overview of the different steps, the different options that you have as a CNA for my fellow CNAs out there or people that's going into it. Those are the 3 options that I wanted to speak about that you could take. Again, if you want to see more, make sure you subscribe to this channel. I have videos dropping weekly, and yeah, we're gonna keep on rolling and keep on going. Again, with my nursing journey, I'll be posting more. I have a day in the life coming out next week because I will be taking my TEAS exam and applying to my different programs. But yeah, if you want to see more, stay tuned because I got more on the way. That's all I got for y'all today. I hope this video helped. Peace.